For the last decades in the United States, income inequality has risen nearly unchecked, and wages haven't kept up with inflation, meaning that in many places in the US, you can't afford to live off of minimum wage. We saw that depicted in Dr. Morris's speech this morning when she showed the maps of New York. But overall, what this tells us is that poverty and income inequality are not a matter of personal choice. In fact, as Mayor Libby Schaaf would say, poverty is a policy failure, not a personal failure. And today we're going to talk about a policy solution to this policy failure. So I'm here today, and thank you for having us this morning, to talk about guaranteed income to improve health equity in US neighborhoods. I'm Lori Dean, I'm an associate professor of epidemiology at Johns Hopkins, and I'm here with the doctoral student who brought me into this work, Sevly Snguon, doctoral candidate, and thankfully is here today on their birthday. Virgo season. So thanks for being here this morning. So I'm going to just start off getting you acquainted with what guaranteed income is. You've probably heard about something. How many people have heard universal basic income? All right, so most of the room. Keep your hand up if you've heard of guaranteed income. Okay, a couple of fewer people. But there are some key differences. So when we say guaranteed income, we're talking about a type of unconditional cash transfer program that provides continuous, that means it's something that's recurring, unconditional, so essentially no strings attached, and unrestricted, meaning you can use the money for anything that you want. It's not necessarily restricted to food, housing, or anything else. And it's to individuals or households with minimal or no eligibility requirements, and it may or may not be sufficient to meet basic needs. So this is an amount that's essentially an income supplement that may or may not actually be enough to meet all of your needs. And in many ways, it differs from the typical social safety net that we have in the United States. It's a steady, predictable stream of cash to recipients to spend how they see fit. And as I mentioned before, it's not the same as universal basic income. And you can see from this matrix that there are different elements that make it different from universal basic income. So universal basic income, which if this pointer works, I don't know if the pointer will show, but universal basic income is down in the bottom, that'd be right corner, left corner for you. Universal basic income is universal and unconditional in many cases, but it's often targeted to everyone, right? It's completely universal. Whereas guaranteed minimum income, which you see at the top, is needs-based. And what that means is GI is actually an equity, a health equity approach, because it doesn't necessarily give equally amounts of money to everyone. Instead, it gives money to people who are in need specifically. And in that way, it differs from equality, it differs as an equity approach. Because as the Robert Wood Johnson graphic would depict, if you give everyone something equally, it might not actually meet their unique needs. So guaranteed income, different from universal basic income, is particularly targeted to people who are at a certain level of need, people who are in poverty, or people who have low incomes. And you might have heard about this. It might seem like something new to you, but this is actually, I would say, old wine in new wineskins. In fact, all the way back in the 50s and 60s, and Sevly will talk a little bit about this as well, Dr. Martin Luther King was talking about a guaranteed income and even said back then, the solution to poverty is to abolish it directly by a now widely discussed, back in the 60s, mind you, measure, the guaranteed income. So this is not actually something new that we've done in the United States. It's just something that's having a resurgence in this moment. So how might this relate to health? Well, there are many mechanisms through which it might influence individual health, but it also can influence neighborhood health, both, I would say, compositionally as well as contextually. So if you give the guaranteed income to individuals, households, or communities, one, it's a complement to the existing social support systems, but it increases people's income and income stability. That could also increase and leverage their opportunities to gain new employment as they get things like stable housing and transportation, and also consider the different ways in which it might affect them individually. So at the top, you'll see things like psychosocial stress, increasing their ability to increase health-promoting behaviors and reduce harmful behaviors. It increases their healthcare access in many ways as a result of increasing access to employment and can reduce some of their unmet needs. In terms of the community, it can improve community-level safety and conditions, people's sense of engagement, citizenship, and their ability to trust and engage, social capital and social cohesion, as well as mitigating things like structural racism. It can improve mental health, physical health, and child health, as well as intergenerational health and health outcomes. And we'll talk a little bit about some of the work and some of the work that we've done, as well as the literature behind this framework. So when I say we, I'm talking about our team. There's me, there's Holly Nishimura, who, this is actually an old slide, she's graduated. She's now a postdoctoral fellow at UCSF. Sevly, who I'll turn it over to a second, and Dr. Marique Moen, who's at the University of Maryland. We partnered with the Mayor's Office of Children and Family Success to do some work evaluating Baltimore's guaranteed income program, as well as looking and diving into the literature of other programs across the nation.
All right. Hi everyone, I'm Sevly. Good to be here in this space with y'all on my birthday, also with my advisor, who's been super lovely and supportive and also sharing space with me. So I'm gonna talk a little bit more about the scoping review, kind of what we've seen up until 2022. There has been a lot of research in guaranteed income within the last 4 years. It has exploded, so you'll be hearing articles. I'll even talk about some of the findings that have changed, where some have actually become null and have been used by news media outlets such as the New York Times to try to discredit the work and the movement. But I'm gonna really discuss really quickly about like what are we learning about guaranteed income and health in the US. So really quickly, this is a scoping review with about 25 studies. It was published between 1976 to 2022, 22 quantitative, 1 qualitative, and two mixed method studies. It goes through an expansive domains of health. We looked at maternal child health, such as low birth weight, child development, preterm birth, mental health, stress, depression, well-being, physical health, nutrition, BMI, mobility, healthcare utilization, behavioral health, and some gaps that we notice in the literature is that there isn't too much research on chronic and infectious diseases, neighborhood health, long-term impacts, and unintended consequences. I'm actually gonna talk about like what we found and like what were the associations and were they positive and negative in another slide. So really quickly in this study, and I would say at the moment, there's probably over 150 guaranteed income pilots that are active, ongoing, or have concluded in the US. A lot of them are still evaluating their findings, but again, this is up to 2022. That was in most of the published literature and the grade literature. So we were looking at different organizations and entities that were doing this work and trying to understand were they studying health. So we do have an example of a guaranteed income. It's the oldest GI program, which was in 1911. It was called the Mother's Pensions Program. It gave money to mothers, single mothers who had multiple children or had children that were dependent on them. There was a very racist aspect to it. It was racist, but it was not as explicit in the sense that it excluded it had a criteria for deserving mothers, and that was a criteria to exclude Black mothers. And I really want to talk about how guaranteed income also, it's about transforming the narratives of who is deserving and who is not. One of the most recent studies is the Babies First Years program. And again, the target populations was very diverse. It looked at mothers, children, mainly indigenous communities, as well as older populations and city-specific groups, like residents of Stockton, which was the study that we cited in there. We had amounts of 81 Canadian dollars to 4,000 USD. The frequency of amounts varied. Most of the studies were monthly. The second most frequent was semi-monthly, and some were annually. And about 15 of these studies reported maternal and child health. There were 16 unique programs, but there were 25 studies because some of the papers did analysis on the same data set or on the same study. So really quickly, Dr. Dean talked about how MLK kind of popularized guaranteed income, but I think we often forget the movement that Black women played in that. They actually made Dr. King and pushed him to put guaranteed income on it, and it was particularly Johnny Tillman, who was a part of the Welfare Rights Organization, a Black woman who understood that the system systematically excluded Black women, but also needed to do better for all women. So she really brought together a movement to really talk about how we need income so we can take care and have autonomy to take care of their children, but also do what they need to do to live the best and optimal lives that they deserve. The next study that we did for the Baltimore study was trying to understand how health played a role in guaranteed income in the perspectives of community and community collaborators. which we learned isn't actually something people think about a lot. They're like, money, which for us, it might come a little bit more top of mind because we're able to understand social determinants, but for many people, they don't actually think about that connection. So in this, we did in-depth interviews with eight community members and eight city residents and 8 city partner community members, which were like members of the steering committee of the Mayor's Baltimore Guaranteed Income Pilot, which was also designed to be the first mayoral demonstration that focused on health. So we were doing a lot of the formative research of trying to understand how people understand the relationship between health. We did a thematic analysis, and I'm gonna go really quickly about the different relationships people saw with health, but also what we found in our literature review, our scoping review. So for social determinants of health, it wasn't a big focus of our scoping review, but it was something that that came up mainly in the interviews and a little bit in our literature review because we wanted to just focus on like health itself. So we saw that people were understanding that potentially guaranteed income can impact financial stability, social determinants of health through financial stability, creating safer homes for folks, having more time to choose and more autonomy, and licensed childcare. We also looked at we looked at both proximal and distal outcomes. For our proximal outcomes, we looked at psychosocial outcomes, which is stress, less fatigue, resiliency, self-determination, and fewer mental health diagnoses. So we are seeing it in a lot of the literature and in the literature of our scoping review, but also in emergent studies that guaranteed income is impacting people's social, their psychological well-being, like stress levels. And I think it's because of the time aspect, which is something we also talk about. We know that health takes time for us to improve, and we know that from even studies from like the Moving to Opportunity study, if y'all are familiar with that, when Raj Chetty then came a couple years later and did analysis and saw that there were benefits for the children of those participants. So for adult physical and behavioral health, we saw that there was food security access, people ate more healthy foods, had access to healthy foods, but we did see a difference between like healthy weight, where we saw some groups, their BMI change, their BMI lowered, but then we also saw in some groups that it also increased. We did see less pain. People were reporting like less fatigue, less pain. We also saw that there was less drug and alcohol use, like less substance use, and that's something that we really want to point out because often when it comes to unconditional cash, people tend to believe folks are spending their resources on drugs and alcohol because of a lot of narratives rooted in racism and et cetera, which I can talk about if y'all have questions about. And we also saw that there was less chronic disease, like cardiovascular disease, diabetes. For maternal child health, we saw a lot of different studies that talk about preterm birth. So we saw less preterm birth. Okay, I gotta go faster. Fertility rate was mixed. We did see infant brain development shift a little, but then that I think became null in the current study, the current iteration of the Baby's First Year study. So access to affordable care, people are starting to go access to care and use. We're seeing folks use more healthcare or use some of their money to go to the hospitals, see a physician, see a therapist. That's also something I saw in the Baltimore interviews itself of some of the participants. And there's also environmental and community benefits where folks are trying to see how this can improve the community or reductions in community violence, social cohesion, but also we're seeing that it's creating safer homes. Okay, Lorraine.
And to supplement some of the work that we saw, we also engaged in a photo voice experiment, demonstration with the Baltimore Guaranteed Income recipients. So photo voice is an opportunity for people to literally go out and take photos of what they see. And we gave them a prompt that said, how has participation in this Guaranteed Income pilot program impacted your life and health? And then we equipped them with cameras to go into their own communities to show us how guaranteed income impacts their health. Photo voice has often been used with policymakers. It's kind of a show as opposed to tell, but has been very, very successful in working with things like food insecurity in policy. So we're attempting to use this as well in guaranteed income. So we don't have time to show all of the results. We soon will be releasing a website that shows all of the results. But one of the ones that we felt like really demonstrated this link to neighborhoods is that one of the participants says, We have these funds, and the fact is we're all able to, be together. Be together is the family representation that you see here. I know it was a lot of families they're in poverty and they aren't able to stay together, meaning their families are being torn apart because of poverty. I'm going to say that we do live in a low poverty neighborhood and we don't have access to a lot of things, but I do like to take my children outside of our community. And then talked a little bit later about we're currently going through a lot living here. They do have roaches and mice. Those are major health concerns. So we're trying to resolve that and possibly moving again. And one of the things that we heard is that there's this narrative that, we're giving people this free money. They're just going to go run around and buy these lavish things. One of the things that emerged from these interviews was that people said, we have more, we have a little more, we can get a little bit better, but this really isn't actually completely enough to transform our lives or to live lavishly. We're just moving from one neighborhood to a neighborhood that's a little bit better. So I think that speaks to the level of resource that people actually need to rise out of poverty and to stay there in a sustained way. And we're running out of time, but just one other one because this is just adorable. Was another picture that said, this baby was born in this struggle. We were homeless, but then we were able to move into a 5-bedroom house, and he has lived a great first 15 months. So just a beautiful story of how a small infusion, this is $1,000 a month, is able to lift people into a different place. So all that to say, guaranteed income has potential positive health impacts. We've seen that in much of the literature on both health and social determinants of health, but notably it can't solve all health problems. So it's a patch for some of the gaps in our existing safety net programs, which we still continue to need, but we think that guaranteed income should be added into that safety net patchwork. We'd love for you to join us if you're interested in doing more of this work. Sevly always had this idea to bring a guaranteed income and health consortium of researchers and community members together to do this work. So feel free to check out the QR code and join us at our, what do we do, monthly or quarterly meetings?
It's probably going to shift to quarterly, but
Quarterly meetings. Thank you.